Hi everyone, this is Divya from Quickmommyhacks, and today we are going to talk about the ever increasing rate of C sections in India. In fact, in India, the rate of C sections is increasing so fast that it's even higher than the threshold which is set by WHO. So, in order to understand this better, why this is happening, and also to know about the fundamental differences between C section and normal delivery, we have Dr. Urvashi Sehgal with us today. Dr. Urvashi Sehgal is a senior consultant in gynecology for the last 25 years with special interest in IVF and high risk pregnancies. She is the director at Phoenix Hospital and visiting consultant at Lafame, Apollo Cradle, and Rosewalk Hospital. She is the recipient of the President's Gold Medal MBBS and Distinguished Service Awards from Delhi Medical Association and Indian Medical Association. She is the pioneer of first water birthing technique in India.
So, hi, Dr. Urvashi, how are you?
Hi Divya, I'm well and thank you for having me here.
Yeah, and thank you so much for actually joining us today to talk about this topic. This is a really important topic we feel about like why C-sections are becoming so common in India and also the differences between C-section and normal delivery. So, moving on to my questions, I guess my first question is, do you, in your opinion, like, do you think that the rate of C-section in India is increasing and why so?
Yes, the rate of C-sections in India is increasing. That is a real fact. And in fact, they have more than doubled in the past 10 years. It was about 8.9% in 2008, 2009, and now has reached nearly 20%.
Mm-hmm.
And we must understand the reason why, because unless we get to the root cause, we will not be able to address this problem. And
Mm-hmm.
then there are two main players in this game, and those are the women who are to give birth, and perhaps their families, and the obstetricians who have to deliver them.
Mm-hmm. Yeah.
So, what is it that has changed? Have the women changed? And the answer is yes. They are older
Mm-hmm.
due to the rising age of the first childbirth, due to
Mm-hmm.
careers, late marriages. Also, there is an increase in the number of pregnancies following the use of assisted reproductive technology like IVF, etc.
Yes.
There
Mm-hmm.
is increase in the number of pregnancies that are complicated with
Mm-hmm.
diabetes, high blood pressure,
Yeah.
and other conditions that are associated with abnormal placental function that has an impact on the baby's capacity to withstand the stresses of vaginal birth.
Mm-hmm.
Also, there are changing preferences of women and their families, like wanting auspicious time and date or wanting to
Yeah.
avoid certain inauspicious time and date.
Mm-hmm.
There is also this fear of a painful vaginal birth.
Mm-hmm.
They want to avoid the anxiety and uncertainty of a prolonged vaginal birth that
Mm-hmm.
may end up in an emergency cesarean.
Yeah.
This fear of a vaginal birth causing damage to the pelvic tissues, which may
Mm-hmm.
result in bowel or bladder incontinence,
Mm-hmm.
and a fear of damage to the baby's brain due to lack of oxygen due to the whatever stresses that happen during vaginal birth. So
Mm-hmm.
all these factors have changed women's perception on childbirth.
Mm-hmm.
Then coming to the doctors, what has changed about them? Well, doctors have developed this fear of medical legal suits that hangs like a sword of Damocles over their heads.
Mm-hmm.
That while trying for a normal delivery, if the baby is born compromised, they will
Yeah.
be sued for medical negligence.
Mm-hmm.
Natural birth, normal birth actually entails frequently unearthly hours. A lot of effort
Yeah.
and time goes into the going for a normal delivery. And also there is this stress of and due to the uncertainty of what
Mm-hmm.
course the delivery will take. And all that then lowers the doctor's threshold to take decisions in favor of cesarean.
Okay.
Then there is this talk about the commercialism, the financials, maybe doctors are paid more or hospitals make more money. That I'm not so sure about if that's a fact, because I don't have that experience. However, this is a debate that goes on.
So, do you
Right.
think like more and more women who come to you, they are like deliberately opting for C-section, and which demographic of women it is?
Well, I would not say that the majority of women are wanting to deliberately opt for a cesarean, but the number of women who ask me or tell me this when when it comes to that time in their pregnancy where we are discussing the birth plan, they'll say,
Mm-hmm.
doctor, I don't think I will go for a normal delivery. I would like to have a planned cesarean. And then I'm taken aback and I ask, because they are a bit hesitant to say this to me since they know that I'm very pro normal delivery. And I
Right.
ask them the reason, and they say they are either very fearful of the pain or a fear of not having the capacity to go through this long, tiring process, fear of harming the baby. Some of them will, of course, upfront say that my family wants a certain auspicious time and all that.
Mm-hmm.
The demographics are, well, of course, it's far more in the affluent.
Mm-hmm.
It's much more in the urban population.
Yes.
And yes, more in the private hospitals than in government hospitals. Yeah.
So do you think like it could be somehow related to the awareness regarding like, C-section? Because of course, like everybody talks about the pain in labor, during normal delivery. But do you think it is kind of related that people don't have enough awareness about the C-section or the recovery from C-section?
So, my take on the awareness or the risks that are associated with cesareans, I would say some are either over exaggerated to the point of phobia in
Mm-hmm.
some of the women, while in others, the repercussions that are associated with cesarean are underestimated and taken very lightly. So, the correct understanding of a cesarean is that it is a very safe surgery, which is life saving for the baby and the mother when performed under optimal conditions
Mm-hmm.
and indications. But it should not be resorted to for just frivolous reasons.
Yeah.
And where a normal delivery is possible, one should always go for a normal delivery.
What are the circumstances that a women, will absolutely need a C-section, be it scheduled or be it, emergency?
So there are certain absolute indications for a cesarean where going in for a normal delivery would be hazardous for the baby, even life-threatening for the baby and the mother. And these conditions are like a low-lying placenta or a placenta previa, which can cause tremendous hemorrhage if the woman goes into labor, or a placenta that suddenly separates out of the blue and there is a torrential hemorrhage which will cause the baby's demise and will be life threatening for the mother. In these cases it's absolutely indicated.
Mm-hmm.
Then a cord prolapse, a cord which may just pop out of the vagina and get strangulated or blocked and lead to baby's death. So this means an emergency cesarean.
Mm-hmm.
Then conditions like maternal eclampsia, where the mother has extremely high blood pressure and may throw fits. Then if she has an abnormal pelvis, so a
Mm-hmm.
maternal pelvic abnormality or a cephalopelvic disproportion, which is a pelvis which is too narrow for the baby to come down.
Mm-hmm.
An abnormal fetal presentation, like a transverse lie. The baby is not head down, but
Mm-hmm.
placed transversely, or even a breech delivery vaginally is now considered hazardous
Mm-hmm.
and should be performed in most first timers as a cesarean.
Okay.
So these are the conditions. A scarred uterus, if there are previous 2 cesareans or 3 cesareans, or a uterine scar resulting from a major fibroid surgery on the uterus, then this
Mm-hmm.
uterus will rupture if put through uterine contractions. Then there are certain other relative indications like non-progress of labor or fetal distress. So cesarean
Okay.
section has to be done.
What is the difference between a vaginal delivery and C-section?
Right. So, of course, I think everyone knows that vaginal delivery is a natural process which involves the baby being delivered through the vagina, while a C section is an assisted process where the baby is delivered through an abdominal incision and an incision inside the uterus. So, in a vaginal delivery, there is no requirement for anesthesia, but in a cesarean delivery has to be done under anesthesia, whether it's regional or whether it's general. And a vaginal delivery can even be conducted by midwives, but for a cesarean, it has to be performed by a doctor, an obstetrician, a surgeon. Now, in a normal delivery, the actual process of pushing out the baby, which is called the second stage of labor,
Yeah.
takes anything between 30 minutes to sometimes 2 hours. And in a cesarean, the obstetrician is able to deliver the baby within 10 minutes of starting, and the whole process takes about an hour. And then the stitching up in a vaginal delivery, there may be tears or an incision given by the doctor to open the vaginal opening a little more, which is called an episiotomy. So that has to be repaired in 3 layers, but it's a small cut. While in a cesarean, the abdominal incision involves the incising of all the layers of the abdominal wall and the uterus. So those have to be repaired in layers. Now, in a normal delivery, the recovery part, the woman can be up and about the same times at the same day. She can start eating, she can start breastfeeding immediately. While in a cesarean, the woman has to be in bed for the first 24 hours. She can breastfeed lying down with help, and she's allowed to ambulate only after 24 hours. You can go home earlier in 48 hours. Even some women go home the same day after a normal delivery, while in a cesarean, it is required at least 72 hours for the woman to go comfortably home. And as far as medication is concerned, in a normal delivery, that is optional. Pain medication or antibiotics are optional. But while in a cesarean, without pain medication, it's unbearable. And antibiotics are a must to prevent infection. And as far as risks to thrombosis, which are clots in the vein, normal delivery, it's minimal, while in a cesarean, women are more at risk for venous thrombosis.
So in terms of like the recovery process or the time of recovery and, in terms of pain management after the delivery, what are the key differences between the two?
So the recovery in a easy, smooth, normal delivery, I mean, you can be up and about almost immediately, few hours. And like I said in the previous question, that it takes 24 hours before a person is able to get up. And pain medication, without pain medication in a cesarean, it's unbearable pain. But with pain medication, it's under control, bearable. In a vaginal delivery, it's almost nothing. Breastfeedings, you can start in a normal delivery immediately sitting up. In a cesarean section, you're in bed, somebody has to help you hold the baby, and then you can sit up only the next day and feed the baby. But even at that time, there is incision pain, so you need a lot more help. And as far as eating, drinking, normal delivery, same time, same day. In a cesarean section, the first day you're on liquids and you can start solids only after 24 hours. As far as having a bath and showering, vaginal delivery, same day. And in cesarean, day 3 is when you can you can take a bath just before you are discharged.
So in terms of like breastfeeding, do you think like C-section actually affects your milk production?
Well, one does see women who have cesareans facing more of a problem if it's their first birth. Women who breastfed earlier may not necessarily, but yes, they do need far more help, and because they have more pain. Now, initiating within the hour of birth In normal delivery, it's very easy. In a cesarean, a special request has to be made because we are practicing that now, that during the cesarean, the baby should be put at the mother's breast. So this is not a common practice everywhere, but we are trying to make it as far as possible for cesarean women. So we are initiating in the operation theater. Otherwise, they are deprived of that for at least
Yeah.
a couple of hours till she's
Hmm.
in the OT. And then later in the room, again, this is being encouraged. So special effort has to be made to initiate breastfeeding in cesarean
Hmm.
mothers so that they are able to successfully breastfeed.
So, this is one thing which I've heard a lot, which is once a C-section, always a C-section. So, what do you have to say about that?
Well, that is not entirely true. It's possible to have a vaginal birth after one cesarean. Some people even say two, but I've done after one,
Okay.
provided the scar that was given in the previous cesarean was a lower segment, and
Hmm.
that this pregnancy, everything is conducive to having a normal vaginal delivery in terms of the presentation and no other complications, and that the mother, the lady who has to deliver, is very strongly motivated. It is possible
Yeah.
70% of the time. Yeah.
Hmm. Coming to my last question, what advice would you give to women regarding C-section or normal delivery, like so that they can make a wise decision?
So I'd like to tell these women that if you prepare your body and with mind with correct information, body with the proper diet and exercise, it is possible for you to have a safe, normal delivery, which enables you to go home early, breastfeed nicely, and be able to be up and about, go back to your exercise and your pre pregnancy body very soon.
Hmm.
And also for the baby, going through the natural delivery process gives them an advantage that the fluid in their lungs gets squeezed out, making them less at risk for respiratory problems of the newborn.
Hmm.
It also gives them a good early dose of the friendly bacteria, the good bacteria, which gives their immunity a boost and their intestinal tract. And it makes them less at risk for diseases, certain diseases later in life, like type 1 diabetes,
Hmm.
like obesity, asthma, and many other autoimmune diseases.
Hmm.
So it's good for the mother and the baby. Although cesarean section is a very safe thing where it is indicated, but we must not forget that it is a surgery. There are complications associated with surgery,
Yeah.
anesthetic complications. There can be blood loss. There can be other organs that can get damaged during surgery.
Hmm.
And also later on, for the next pregnancy, there can be placental abnormalities that can happen because of a previous cesarean. There can be uterine rupture as well.
Hmm.
So I want all the women out there who are planning for childbirth to weigh the pros and cons of both and then choose wisely and choose well.
Thank you, Dr. Urvashi, so much for all this information. I mean, it has been really helpful, and I'm pretty sure it's going to help a lot of women out there, remove their misconceptions about normal versus C-section delivery. It's going to help a lot of people. Thank you so much. If you like our videos, do subscribe to our YouTube channel, Quick Mommy Hacks, and follow us on Instagram for some personal tips on pregnancy, childbirth, and motherhood. And do leave your feedback and comments. We would love to hear from you.